It is Wednesday, April 22nd. Watkonurados Oguegu, Joe Dalaron Ujets. Welcome to our daily COVID-19 Task Force update. Today on the program, we'll be talking to Derek Montour, the Executive Director of Kahnawake Sugotiat Genhas Community Services. Lloyd Phillips, the Commissioner of Public Safety, will be joining us. But before we get to that, we'll go live to a couple of people who are working on the front lines. And we'd like to welcome Mike Horne, who's the Manager of Home and Community Care Services, along with Tracy Johnson. And we'll start with you, Mike, Manager of Home and Community Care Services. Sounds like that encompasses quite a bit. So just explain what you've been up to and what does that job entail?
Okay, yeah. Wait, Joe, I guess I'd like to share that. Basically, yeah, I mean, not only myself, but all of our team has been very, very busy since the onset of this pandemic. We've really had to make a big shift in our services, as well as ensure that we maintain all of the services that we had prior to going into the pandemic. So there's been a lot of work that has happened. One of our main focus is Turtle Bay Elders Lodge, which we have 22 residents. Majority of them are 70 plus in age. So basically, we've really been proactive and putting a lot of measures to ensure that we're adhering to a lot of the directives. With the ultimate goal is to provide them the ultimate safety, and in regard to this COVID crisis, is to prevent any outbreaks within the lodge. So first of all, I guess the first question, first thing I will answer is we have been fortunate that we have no cases of COVID in the lodge. And that's one of our main focuses, again, is to maintain that level of care.
All right. We know that the staff has been pretty busy. I guess a question that a lot of people would have is, at the Elders Lodge, how are the residents doing? Because it's a change for them as well. It's a huge change. How are they reacting these days?
Okay. So first of all, I'll give you some of the, in terms of a timeline, like how fast time goes. March 14th is when we first put in the directive to prohibit visitors from coming to the lodge. And that included our day center program, which is people who reside in the community. So that sort of broke that socialization stimulation that the residents get. And then after that, one of the biggest impacts came, directive was March 22nd, where basically we were informed, a directive came out that anybody 70 and over needs to self-isolate in their rooms. So we're looking at today, it's basically a month that they've been self-isolating in their rooms. So to answer your question, we've been monitoring them on a daily basis. We have staff that are frontline services, such as kitchen cooks who are in there 3 times a day with their meals. We have our home care nurse, Janice Patton, and then we have our home health aides who are providing medical assistance or personal care to our residents. And then we have the activity program. So these people are doing a self-monitoring of all the residents to make sure that their social well-being is being taken care of. So to answer your question right now, I mean, we have to give credit to our residents. They're very resilient, and they've been doing very, very well.
All right, thank you very much. Let's go to you, Tracy. You're the Manager of Home Care Nursing. We'll get back to the Elders Lodge, but the home care nurses have a pretty wide responsibility. So tell us a little bit about what it's been like for you and your fellow nurses in this time of the pandemic.
It's been a very challenging time. Things came about quite rapidly, and it was we had to make adjustments quite quickly. So I was on K103, and I had mentioned that we service over 200 clients in the community. And that's a big responsibility to ensure the care and the safety of these clients. And many of these clients require a lot of nursing care. So we knew that we had to continue with our essential services, but we had to strategize and look at ways that we can interact less with our more independent or the clients that we see sometimes from afar, just to make sure that they're doing everything possible to take care of their own health. So we had to restructure in that way to what we call routine visits. They had to be decreased a little bit and switched for phone triage, phone consultations. So much like the doctors are doing at Kahnawake, they're doing phone consultations. The home care nurses had to implement that with a certain population of our patients. But we have our patients that require ongoing blood tests and dressing changes, wound care, many different nursing interventions. So these essential services had to continue. So working with the task force as well as our management team at Kahnawake Hospital, being guided by Dr. Gauthier and Lisa, Dr. Jones, the whole team, in ensuring that we're adhering to all the directives of the ministry and make sure that we're doing everything properly. I can't say it was easy. It was very challenging, but when there's a will, there's a way. And you know how we are for our people. We'll do anything we can to make sure that they receive the best possible care and that they're safe.
I know that as a nurse, you guys have a lot of processes already when you do home care. But in this time, is there an escalation of processes to keep both the nurses and also the clients a little bit safer?
For sure. So all our nurses had to go for a refresher course in putting on the personal protective equipment. Because, you know, if you're not doing that all the time, you're not working in an operating room, an emergency room, you fall out of practice. So definitely everybody had to get a refresher. All the nurses had training in regards to testing. Two of my nurses were working at the test site for a certain period, and one remains there. So they had to really be on top of their PPE training and all their infection prevention and control practices. In the homes, we have to do a lot of education and reminding the community that when you go into a hospital, there's a lot of things that are in place. It's very structured. But when you go into a patient's home, it's not as structured. So we have to remind them that, you know, we're here to take care of you, to provide you with the essential care you require. So we all have to do this as a team. You, your family, whoever lives with you, we have to follow the social distancing. If the need be, the self-isolation that we may, you know, at the beginning, it wasn't, there was a lot of information that came out at once in regards to masks and when to wear a mask and the whole, you know, a gown, gloves, the booties even in homes. So we had to really strategize, read all the information we were being given, have meetings regarding it to make sure that we put all the essential measures, hand washing, remind the client that they too must do their hand washing. And if we go to see a patient who's not well and we're assessing them, well, they have to put on a mask as well as the nurse. So we had to really do a lot of adjustments in the way that we do provide care. But the team did excellent, but we had excellent direction, so it made things a little bit easier. But I think the biggest challenge is how fast the information was coming and how fast the directives were being updated. So we really had to be on top of everything, you know, as the information came out.
Okay, Mike, we have a couple of minutes left here. I know that you guys had to come up with a whole bunch of processes as well. Just if there's anything else you need to talk about here while we have you for a moment, go right ahead.
Okay. So yeah, I guess it's pretty much in line with Tracy has said. A lot of the directives, like I said, as management, we've been meeting with the team leaders. We've been having video conferences every afternoon for about an hour and a half. And basically, we've been sure that we got the directives, that everybody's on the same page, and that all of this information is disseminated to our frontline workers.
All right, Tracy.
How many two clients?
I
Sorry?
just wanna to add, although we did have to decrease services in like the area of, our routine visits, we had to increase service with our population of 70 years old and over, because we received a directive that anybody that falls into this category needs their blood test done at home, because we're trying to encourage our elders to stay home, to stay out of busy areas, not to go into clinics or hospitals for any unnecessary reason. So this is a service that we've added, and this has given us a big increase in patients.
All right. Well, we'd like to thank both of you for taking time out of your very, very busy days. I know these have been long days as well. So Mike Horne, Manager of Home and Community Care Services, Tracy Johnson, Manager, Home Care Nursing. We'd like to thank you both for taking time to talk to us today.
Thank you, Joe.
Thank you. I just want to add that we're both very fortunate to have such awesome teams. Our teams are doing great. We want to continue to encourage them.
Yeah.
All
Same
right.
thing here. I want to validate all the staff that have been working, gone above and beyond, and it's something that I think that we're still up for the game, and we're going to continue on this path that we're on. So thank you very much.
All right. Thank you. All right. So very interesting and informative interview there. We'd like to thank them both. And right now we'd like to welcome actually their boss, the executive director, well, one boss, the executive director of the Kahnawake Sigottiat Community Services. Mike Horne works under his direction. Of course, Tracy works under the Cattery Memorial Hospital Center. But Derek hasn't been on for a while. I know he has lots to talk about, so let's welcome him on board. Derek Montour.
I offer my greetings to all of you as my brothers and sisters, and I hope and pray that all of you are safe and all of your families are safe and they continue to be so. I guess I'd like to start my update, because it's been a while, with really just echoing Mike and Tracy's words, in that really a big, huge shout out to all of our teams throughout KSCS and throughout the KMHC, whether it's at the front lines, the maintenance teams, the supervisors, the managers. The entire team has really come together throughout this ordeal, for lack of a better term, and really pulled together and formed as a team. I'm very, very grateful to have the opportunity to be the executive director for KSCS, and it's really as a testament to the staff that we have in our community, not just in those two organizations, but really all of it. I get often accolades or congratulations or really, wow, you guys are doing a great job from different parts, and whether it's in the region, whether it's other First Nations communities, and sometimes even across Canada. So really a shout out to all of the team that's pulling together. I also want to say a shout out to all of you community members who are really abiding by directions, the directives that the task force put in place, and is really trying your best to follow the difficult measures that we've had to put in place to address for this task force. Thank you. I know it's difficult, but it's working, and we see the result as we keep moving forward. I do today, I don't want to get into any of our other duties, but I do want to give the community an overview on where KSCS is at today and how things are going. As you heard from Mike and Tracy, we do have a shelter in place at the lodge. We also have a shelter in place at the Independent Living Center. They also have 0 positive cases, and the team is doing well. We outreach to all of our clients on a daily, regular basis, and all of them are doing wonderfully. I do encourage all community members, if you have family in either one of those facilities, please don't be shy. Send a note, drop in a little care package that's obviously safe, or at least to say hello in a video conference or a telephone in some way. Everybody needs to feel connected. Maybe not drop in a care package. Maybe that's the wrong term. Sorry. Next, I want to mention the other shelter we had. We had put in place an emergency isolation shelter. So far, 4 community members have taken advantage of that shelter. It is still available if any community members are interested. In particular, it's for travelers who are coming back to the community and need to isolate. It's not for back and forth traveling. It's really to ensure the protection of our community, and that's why we put it in place. If you have a need for that, you're welcome to call the KSCS intake at 632-6880 and ask for this shelter intake. It's also available for essential service workers to also provide additional protection to not potentially transmit the COVID infection. I want to talk about the food service real quick. Amazing job that we're doing out there. A great, huge help to the Cattery Food Basket Committee and who've partnered with us on this. I'm proud to say that we've given out approximately, and we are servicing about 225 different households with the food basket on a regular, consistent basis. It's a huge amount of support, and really, I can say in complete confidence that there's not many communities have gone to this length to really ensure all of our community members are safe, have food, and are healthy. I also want to say that we have approximately 180 elders or community members with limited mobility who are receiving a hot meal service both at lunch and their evening meal that they can reheat. So again, those are huge numbers that we're able to support with a hot meal service. And finally, we're servicing approximately 67 essential service workers with a hot meal during lunch or dinner as well on the weekdays, and another roughly 24 essential service workers on the weekends. So again, is a 7-day-a-week service that we're able to provide for our community to ensure that those essential service workers who have difficulty enough already getting things could at least enjoy a hot meal. So I want to thank the community for all the support in that. People still ask about donations to the food services. You're welcome to deliver, to offer a donation. You can either give hard, physical, concrete donations at the Cattery School, or if you want to give a Montour donation, you could give it in care of KSCS, and we'll ensure that it goes directly to just the food services. We are not giving out, we don't use those donations for other services. It really is for that activity. Final words, I want to talk about real quick some of the services that are there and available. KSCS website, kscs.ca, a huge amount of links and resources are available as soon as you open it up. The KSCS Facebook page has a lot of links. We opened up a second Facebook page called Ganinkunrio Good Mind for really about positive mental wellness. A third Facebook page called Let's Talk Kahnawake, and that is for really about counseling services and explains how to access that. Counseling is available to community members. I want to encourage you, you hear some heavy stuff here sometimes on these updates. If you feel you want to talk to somebody, call directly the number 514-235-9607. Again, 514-235-9607. The hours are from 5 p.m. till 8 p.m., and you'll directly talk to a counselor. Of course, if we're overwhelmed, we'll deal with it as we can. After hours, outside of those, you can call the peacekeepers and ask for the after-hours response worker. The final thing is I encourage you to read our latest newsletter. It is, you can access it on the KSCS website. I want to wish all of you peace and happiness, and please remember to give your family a kiss whenever you have an opportunity. Now.
Go, Derek. And I was speaking to Derek just before he went on a few minutes ago, and we talked about people accessing services, those who are a little nervous about how things are going. And I know people are sometimes reluctant and feel like, well, I don't know, am I overthinking this? Make the call, because as he told me, they get plenty of calls, so you're not going to be the only person calling in. A lot of people are being affected by this, and a lot of people are taking advantage of the services. Okay, so thank you, Derek, and it's time to bring on our Commissioner of Public Safety, Lloyd Phillips. He'll be our final presenter this afternoon. Lloyd, it's all yours.
Thank you, Joe. Thank you, Derek. Thank you to our other presenters this afternoon. We're trying to bring a little more of information from people who are certainly working the front lines, but not the people that you see here in front of the camera on a day-to-day basis, just to give the community a sense of that there's more to the people who are just on the task force, but there's people who are doing the frontline work, throughout the community on various levels. And keeping in mind, a lot of these people who are working in the organizations and entities that are operating also have a full load of work that they have been doing prior to the pandemic hitting us. So there's a lot of work happening. And we're trying to give a little more of a perspective to the viewers that there are more people who are doing work on the ground. We did have a COVID task force meeting this afternoon. Again, another good round of discussions. And I just want to touch on a few points that were discussed in general, but also in a roundabout way, and which also led to a release of a communique that went out this afternoon. One thing that we want to put out there again is just more of a reminder to the community, and that the task force, as things evolve and the way things have been transpired and various directives that have been issued, and obviously a couple of weeks ago when the signage went up around the community saying residents only and essential services only and so on, that again, if you want to talk about maybe core principles that guide us, what's guiding the task force at this point are two principles, and the principles is Kahnawake is for residents only, and that Kahnawake is operating under essential services only. I mean, those are the two key principles that are guiding us. And anything that works to support that is what we want to see in our community. If something is not to be deemed essential, at this point in time, we're still saying that that's something that is not permissible. That's something that has to wait until we're on the other side of this pandemic. So those are the main two principles that have been guiding us. Yes, there have been several other directives and recommendations and everything that came forward. But in terms of if you want to call it restrictions or limitations, those are the ones that really guide us. And we've been working very hard and being very diligent to make sure that these directives apply across the board. So it's been a struggle at times, because there's many moving parts to our community. We're a very diverse community. Businesses and people have various ways of doing their business and various ways of conducting their lives. So it's hard to be uniform across the board. But I just want to reassure the community that the directives that are put out there do apply across the board. And we're doing our due diligence with our inspectors and as needed with the peacekeepers to ensure that the directives are followed according to their original intent. What we need to do is ensure that we stay the course. As mentioned before, we're moving down the path of this pandemic. How long that road is, again, we're still not 100% sure. And nobody will give you a definitive answer. But one thing I can say with some certainty is there's more road behind us than there is in front of us. And if we keep our foot on that gas, and we keep the measures in place, we keep cooperating as a community and do what we got to do, we're going to reach the end of that road sooner rather than later. If we let off, again, that road's going to seem much longer and take much longer to get to our destination where we want to be. So again, the message is, again, we stay the course, we maintain what we're doing because we are doing a great job as a community. And the reason why we have low numbers and zero numbers in terms of serious illness or death is directly result of these measures. Maybe there's no scientific proof that will show that, but I'm confident, based on everything I know and everything I've seen since the beginning of this pandemic, the actions taken by the community. And I do say community. I'm not taking the credit as a task force because without the community supporting us, these measures would not work. But certainly, it's a direct result of the community's actions in response to this pandemic is why we could say we have no serious illness and no serious death at this point. So again, that's hats off to our community. Because keep in mind, as we speak today, and over the past week or so, nearly, on average, nearly 100 people a day are dying in the province of Quebec. And the majority of them are just over the river. We could almost throw a stone over into Dorval, into Montreal, and other places, and over there, nearly 100 people a day are dying. So, it's not far away from us. It's not on the other side of the globe as it was months ago. It's literally in our backyard. So, we have to keep that in mind moving forward, because it won't be hard, if things our measures are let off and we have people coming and going in our community, having as they were in the past, that it's not hard to have that virus start circulating in and around our community again, which is the last thing that we want to see. A matter of fact, even as of today, I think that the official number was 1,134 people in the province of Quebec have died of COVID-19. That's slightly above their original projections, but obviously much lower than the worst case scenario. So generally, it's on the right track, and as I mentioned before, those numbers are starting to stabilize, but they're stabilizing at a high rate. Once they stabilize, and then the next phase we're hoping for is to see again that decrease on the numbers. Once again, I want to address the issues of some conflicting messages. And a matter of fact, I even got a request from CBC TV to speak on this issue, but I'll speak to it first on our community, because they're hearing different government sources in Quebec and even in the city of Montreal about loosening up certain measures and opening up schools and different things of that nature. And they're asking, saying, well, how does that impact on Kahnawake? Because they understand that many First Nations, including Kahnawake, are more vulnerable than other populations. So how does that impact us as a community? And this is coming from the outside. And the simple answer is we, like I said before, what they do on the outside, we analyze it, we see what they're doing, and then but it'll be the Kahnawake COVID task force that decides how that does or does not apply to our community. So when it comes to issues like schools, for example, it will be the Kahnawake COVID task force who will determine, if and when schools will open. And we'll also decide if and when other governmental organizations reopen and things of that nature. So, because I know I've been asked many times, because you see those news reports and such, and obviously the outside media as well as our own community obviously want to know how is the impact on us. But we did address it here on Facebook Live before. But I figure it's a good time to reinforce that message that we are operating, under the authority of our community, under our own Kahnawake emergency preparedness law. Which brings me to one of my other points I wanted to address. Is we talked about it yesterday, as well as was on the radio this morning with the Council Chief Tanya Perron, that the declaration of a state of emergency, and some people were still asking, why was that done? Why does it have to be in a form of a resolution versus the way it was done in March on March 16th? So just to maybe to clarify a couple of points on that, it's first of all, it was declared by what's called the Mohawk Council Executive Directive that a public health emergency, which is nearly equivalent to saying there's a state of emergency. There's some legal technicalities that some people may say, well, it's not quite the same. But in order to eliminate any of that uncertainty, is a public health emergency the same as a state of emergency? So we went back to the law, and the lawyers looked at it and said, no, just to be on the safe side, let's make that formal declaration of a state of emergency according to the Kahnawake emergency preparedness law. That way, it solidifies what we're doing, and it makes it clear the authorities in which we're operating. It also makes it much easier in the future. There will be dollars that will be allocated from either provincial or federal authorities that the community can access to cover off some of the costs associated with dealing with the pandemic. And if your community has not declared a state of emergency, you may not be available for certain funds. So there was multiple reasons for it, and I understand it caused a little bit of confusion. But just to say the task force itself, our day-to-day operations do not change because of the change from a public health emergency to a state of emergency. And actually, this had came up in discussion. Actually, it started off with some of our inspectors. We have inspectors that are out there who are circulating in the community, checking up on various businesses and other areas, just to ensure that the health authorities, the health directives are being followed, following up on other various. If somebody needs an essential service repair, that there's just somebody there to ensure that the directives are being followed. And they had questioned whether or not they have the legal authority to do so. So that's what actually really sparked this whole discussion. And then looking at the whole thing, again, we just wanted to make sure that when our inspectors show up there, they are there under a legal authority. In this case, which is the emergency preparedness law, and they also have the sanitary conditions law. Because certainly, of course, the peacekeepers have the authority, but again, it's a matter of being a subject matter expert, as they call them. The peacekeepers are not aware on how to go inspect a restaurant or how to inspect something for an occupational health and safety. That's not their role. So now we have these inspectors who are from the community in and around circulating. So this gives them that extra level of security. And with that, I know some concerns were raised because part of the emergency preparedness law states in there that the council can make or modify laws to deal with the emergency by, I think it says, by a simple majority vote. I know that raised some concerns in the community, and I just want to address that in two ways. First of all, my goal regarding the emergency preparedness law and what has to be done my goal is to be non-political. No, the task force will not set up in a way to deal with political issues. Our goal and my goal here is strictly for the health and safety of our community, and that is what drives us, and that's what will continue to drive us to remain in that way, because we're saying this applies across the board, and that's how we have to do it and be inclusive as we possibly can. But according to the Kahnawake emergency preparedness law, like I mentioned, it gives the council in a state of emergency, the ability to make modifications to laws that are directly related to the emergency. So just to be clear on that, first of all, the state of emergency, once that expires, the mandate of the task force expires, the directives expire, and so does the ability for council to make modifications to laws related to the emergency. So when we talk about the ability to change laws, again, it has to be directly related to the emergency, and there's a process there. And what that process would look like, if there was a need for a modification to, say, the emergency preparedness law or the health and safety laws of the community, that would first be identified by the task force. We would say we need certain elements changed within a law to give more credence or more legal authority to what has to take place, and that would come from the task force. We would relay that to legal and to chief and council, and they would draft up what needs to be done to ensure that meets the need. And it would be strictly based on again, health and safety. Just so you're clear as well, this doesn't mean council has free reign to say, well, we're going to go change the membership law, or we're going to go change a law on criminal law or other types of law that has no bearing on this. They have no authority to do that. The CDMP process still remains intact for that purpose. It's only, again, just to deal strictly with the emergency at hand. And again, my goal here, and it has been from the beginning, and it will remain, to be non-political, and I don't want to have, I don't want to create those debates within the community. So I hope this explanation helped clarify any of those concerns that people may have had. And if there's any further questions, well, we could address them at future Facebook Live outlets. So with that, we're going to be moving forward with a lot of new faces in the next little while to give you perspectives from around the community. And I once again want to reach out to the community and thank you for your support. We see some of the posts on Facebook. We see, we get the emails and such, and we really helps us to get through the day when we know we have the people who are supporting us and backing us up, and understand that we're here. Our sole purpose is for the health of our community. So let's stay with it, Kahnawake. We again, like I said, there's more road behind us than in front of us, and only with your cooperation we'll get there soon. Nyawagawa.
Now, Lloyd, well done. Great explanation. Even I could understand it. Nicely done. By the way, just a comment on the political processes. In terms of political decisions that are made, you can always check. Every Friday, the council communique comes out, and it is actually a review of what happens in the council meeting and decisions that are made. And you can check it out at kahnawake.com. Final note, Lloyd also mentioned that the statement went out today. Attached to that is actually a list of all of the directives that have been passed or have come through the task force since the beginning. And there's a link on that, so you can go to the website again, kahnawake.com. You can also go to covid-19.kmhc.ca. Everything will be there. But just check it out. It's right on the press release. You just have to click on. The information is all there. We'd like to thank Mike Horne and Tracy Johnson, as well as Derek Montour, and of course Lloyd Phillips. Most of all, we'd like to thank you for joining us today. We will be back tomorrow. Just a little note, on Friday, Dr. Annick Gauthier will be back again. She managed to work it into her schedule, so we'll be happy to see her once again. If you have any questions for her, just send them to questions@mck.ca and we'll forward them to her. So on behalf of all of us here, Nyawagawa Dano, Onigiwahi.